Today, we are thrilled to have Adrian Piterney and Janelle Marietta with us to present on 211 Alberta. Adrian and Janelle are the Community Engagement and Resource Specialists for South and Central Alberta. Adrian is based out of Red Deer and Janelle is based out of Lethbridge. Their role is to get into the rural communities of Alberta, inform community services and organizations on what 211 is, the benefits of listing on 211, and assist in getting them listed. The ultimate goal is to have rural Albertans be accessible to 211 and receive services in their own communities when they need them. So I will now turn things over to Adrian and Janelle to get us started.
Well, thank you. Great introduction. That kind of stole half of what I was going to say. So again, my name is Adrian Piterney. I'm in the central area. So we actually have four community engagement and resource specialists throughout the province. We have two in the northern part of the province. So northeast and northwest, that's everything north of Edmonton. My section is between Edmonton and Calgary. So basically everything between those two cities, border to border. And then Janelle is southern Alberta. So as you can see, the slideshow is kind of starting. So I will pass it on to Janelle to maybe introduce herself really quickly again and start things off here.
Awesome. Good morning, everyone. My name is Janelle Marietta, and I am calling in from Lethbridge, Alberta, so down in the South Zone on Blackfoot territory, and really excited to be here. So hopefully we'll have some Lethbridge or area representation in the comments too. So we'll jump in. I'm going to go quickly here through what 211 is. I think we're recognizing that many of us in this call might be hearing about 211 Alberta for the first time today, or haven't had any kind of experience prior to this. So we'll go in. If you've got lots of experience with 211, bear with us, but we'll go through this information quickly just to get everyone up to speed. So ultimately, you're probably asking yourself, and we were just chatting about this earlier, what is 211? How does this work? And it sounds suspiciously similar to a lot of the other 11 numbers you might have heard. So we are very similar. We are a province-wide number. 211 Alberta specifically works across the Alberta communities. We do have 211 available across Canada as well, so that's good to know if you have callers that might be hopping around communities or moving interprovincially as well. So 211 is available similarly to any other 11 number you can call from any phone line, and you will receive somebody on the other end to answer that call. So exactly the same way as a 911 call, 811, 311. It is essentially a service that you can dial from any phone, which will bring you to the correct 211 office closest to your location. I might get into that in a minute here. We'll just keep jumping through here. In terms of where those calls will actually take place, I'm going to talk to you about the anatomy of the call as well, but we'll move through that. So essentially our vision at 211 Alberta is to empower communities to connect individuals with supports and services that they might need right when they need them. Our mandate is essentially, we are the number you should think of when you don't know the answer to whatever question you might have. So very often we see calls where people might have some kind of a social issue coming up, or some kind of a disconnect in terms of where they can turn to, where they can start receiving supports. 211 is here to connect people to the services in their communities, in their local regions, that can help with whatever issues are coming up for them. So we'll see things like food security. We'll see things like people are, maybe you've received an eviction notice and you don't know what to do. You don't know how to handle it or where to turn to. We are the right people to call. Our team of call support will answer those phone calls or answer those text messages or web chats, whatever is coming in, and we'll be able to help those individuals navigate specifically the issues that they're up against, right? So and again, I'll go into a little bit more detail on how those calls work and what that'll actually look like. But essentially our team is made up of team members across the province. I think Adrian and I are kind of demonstrating that well today, calling from two different locations across Alberta. We also have our two call centers. One is located in Calgary, which is ran through the Distress Center of Calgary. And then we have our second call center up in Edmonton, which is actually housed under the Canadian Mental Health Association. So this is a collaborative partnership between these three organizations with United Way Alberta Capital Region rather, CMHA Edmonton and the Distress Center Calgary. It has been running for many years as a collaborative in this way, and it's just a really great demonstration of how working together in partnership can help solve some of those issues for Albertans. Again, we are a 24/7 service. We operate all year round, and so it's never a bad time to call 211. We're always available. You can dial 211 through your phone or cell phone. You can text if that's easier. We recognize that often when issues are coming up for people, if there's anxiety or there's concern about speaking on the phone, or maybe it's not safe to do so, text message is always a great alternative and a great option for people. So you can certainly text. You are still going to speak to a real person on the other line, regardless of how you connect with us. And I think that's a really important thing. It will not be an AI bot. It is a human being on the other line responding to those needs. So whichever avenue a person decides to connect with 211, you will get a person there on the other side to help you navigate whatever issues are coming up, as well as through our web chat. You can go to the Alberta, so ab.211.ca website and use the web chat. And again, another human being will be on the other side to answer those calls. We are, and I know Adrian will get into it in a minute here at the end of the slides, but we do offer our services in 170 languages as well, which I think is a really excellent offering. Certainly we get lots of people who can call in and maybe, especially when you're feeling stressed, there's nothing worse than trying to go through and navigate translation or second language under those stressors or pressures. So it is really easy. It's a quick process. You can call in and within minutes we'll have a translator connected to the call. I should say an interpreter connected to the call who will actually be able to address those concerns in native language, which is great. And of course, it's free and confidential for all Albertans. I'll pass it off to Adrian. He's going to go through a little bit of or do you want me to? Maybe I'll just take this one and keep going. I'll pass it off at the database, perhaps. I'll go through some anatomy. Give me a minute here. So essentially, you're probably wondering how this will work. When you call in or you text or you web chat with 211 Alberta, there will be another person on the other side of that call. These are our community resource specialists. These are excellent human beings. They've gone through a great deal of training and have some really amazing knowledge in terms of system navigation, how to support individuals going through whatever concerns might be coming up in those phone calls. Any reason that you would be calling 211. Both of our call centers in Calgary and Edmonton are both accredited through Inform USA accreditation process. And so that essentially ensures that our referral systems are solid and that we've got a really strong database of resources within all of the communities across Alberta to support needs that are coming in. So these are all certified, amazing people. Hopefully we'll get into if anyone has actually had any experience in contacting 211. But again, I certainly open up that option in terms of if you've ever been interested, certainly reach out and try it. It's a really cool service, and it's certainly I think a really great resource across the province. Our community resource specialists essentially will go through a referral process. So their role is to identify what those needs are from the caller. Sometimes that's not always so simple. Sometimes there's a lot of dynamics to a person and the reasons why they're calling into 211. So our resource specialists will go through and help to identify priority issues, but also look at other support options that might be needed further down the road. We have a process called the warm handoff. So essentially our team will try to establish rapport, try to assess the needs that are occurring. First and foremost, determine if there's risk or if there's any safety concerns for our caller, just to ensure that their well-being is prioritized first and foremost. So they go through that process. Once we've determined what steps might need to be taken in terms of supporting the caller with whatever issue might be coming up, and certainly recognizing that very often our calls become complex. The way we define complex in the 211 team is when we've got more than one issue coming up for the caller. And that very often does happen, and I'm sure we'll talk about a lot of that in the questions and examples, but that does happen quite frequently in terms of multiple issues that might have compounded, which has gotten someone to a place where they need to reach out to 211. So we'll go through and prioritize those calls, prioritize a plan in terms of how to address the issues that are coming up, what services would be best to refer to, and then we go through that process of actually determining referrals and setting people up or connecting people to the right programs in the community and the right services that would be helpful. Our team is amazing and they go through a warm referral process. So very often, and I'm sure you've all seen this in your own communities, it becomes really difficult to have to share our stories and share some of the issues that we're dealing with when we have to reach out for help. Reaching out for help is already challenging. And so having to retell those stories can become quite damaging or harmful or hurtful for individuals that are asking for support. And so we go through a warm referral process, which allows our team to reach out to the referred services, to set that individual up with the services so that they don't have to have the same conversation with 7 different places with that same issue coming up, right? So we do our best to mitigate any of that energy and that time and some of that harm that can come up with having to retell those stories over and over again. So warm referrals are really important to our team. That's a really important thing that we think helps support our communities in that way. And the other really important thing that I think 211 does is we offer follow-up. So once we've connected someone, we've identified what issues are coming up for them and what services would be best to connect them with in terms of addressing those issues. We recognize that the concerns could be complex. We might need to do other follow-up referrals a week from now, 2 weeks from now, once we've dealt with the first priority issue, and then move through that process. So we do offer follow-up calls as well. So our team will offer it. It's certainly only available if someone would like that service. They can certainly decline it, but we will have our team follow up within a couple of days or a week, whatever is decided in that call with the individual that's calling in, to help them navigate next steps after that process. It's also important just for us to determine if the service that they were referred to was helpful, if that actually did address the need that was coming up, or if we need to start to look at other resources as well. So we've got quite a few different ways, and we're going through this very quickly. So there might be questions later on this, but these are all really important ways that our team will connect people to the right services in their community as they're contacting 211. Now I will pass it off to Adrian and he'll get to the database.
Thank you, Janelle. So one thing that with the warm referrals is the 3 agencies in the partnership. 2 of them are call centers. So those call centers are not just 211 call centers. They actually do a lot of crisis call center work as well. So everybody's heard of, well, hopefully everybody's heard of 988, the suicide hotline, things like that. So those warm handoffs actually translate to those crisis calls as well. So they can hand them off to the crisis workers, get some immediate assistance, and then they can hand them back to 211 to access all the other assistance they might need. So the slide that we're on right now, we have over 35,000 records in our database in 211. So Janelle and I, Mel and Kelsey are in the northern part of the province. So there's 4 of us. We're really trying to work on getting this increased. 35,000 isn't enough because, as you can see by this map, it's actually pretty accurate. All the gray areas there are where there's not a lot of agencies listed, and we're really trying to change that because, like it was said at the very beginning, when people seek help, we want them to find help in their own communities. We don't always want them to get referrals to, whatever city is closest to them. If you're in Concert or, Red Cliff or something like that, you don't always want to get thrown into whatever big cities there. So we really want to find those resources in their own communities. And I will apologize, Janelle's the one running the slideshow, so I'll have to cue her every time we need to change the slides. So Janelle, if you could change the slides. So across the North America, about 3% of the population actually accesses 211 services. So 211s are North America wide. However, in rural Alberta, as you can see, Edmonton and Calgary regions, they're pretty close to that 3%. Rural Alberta is sitting at 0.8%, meaning that we have a tough job ahead of us to try to get more awareness out into the rural areas. And that 0.8% actually includes the smaller cities in Alberta, the Red Deers, the Lethbridge, Medicine Hat, Grand Prairie, Fort McMurray. So in the small rural communities, it's actually far less than 0.8%. So we're really pushing hard to try to get more interaction, more agencies listed, and more people calling 211. Janelle, next one. So in 2023, we had 88,127 contacts through 211. 41% of those were from the Edmonton region, 45% were from the Calgary region, and unfortunately, only 14% were from the rest of Alberta. So again, we're really working hard to try to get out into the rural areas and get everybody connected because we know that the trend is very much, centralizing Edmonton, Calgary, and we want to try to showcase all the great programs and agencies that are available in rural Alberta. So these are the most up-to-date stats we have. So 2024, there was actually 99,724 contacts with 211. So I say contacts because 88,000, well, just about 89,000 of those were phone calls. 45 or 4,600 were texts, and just over 6,000 were web chats. So our predominant way of communication is still phone calls. And Janelle kind of touched on the needs identified. Oh, if you could go back there, Janelle, things are popping around. When Janelle said that a lot of times when people call, there's more than one need identified, you can kind of see that there's roughly 100,000 contacts, but 161,000 plus needs identified. So most people have more than one need that they're looking for. And from those, we gave out over 266,000 referrals to different agencies. So we really try to give out more than one referral, 2 to 3 referrals for each issue that people are calling about, because we know that people want selection and choice, and not one place meets everybody's needs. Okay, hit it now, Janelle. So as we've discussed, there are several different pathways to support at 211. We've covered calling, so 211 you can call anywhere in Alberta at any time, and you can actually access services in any other community in Alberta. So if you're calling from Fort McMurray and you say have a child at University of Lethbridge way down south, and you're looking for supports for them, you can call and get supports in Lethbridge from Fort McMurray or vice versa. Now the 211 calls, that's the best way to go if you have what Janelle called complex needs kind of thing. So if you have something that's more than just looking up a quick referral, that kind of thing, we definitely encourage the calling, the texting, the chatting, something where you can speak to a live representative on 211 because they are really professionals. They can dig out information and referrals like nobody's business. It is a little bit tougher when you get to your self-searching options. So we do have a self-search option on ab.211.ca. And I'm actually going to go through a little bit of that because searching is a little bit different. It's not like Google. So Google is very much just a keyword search. Searching the 211, 211 is based on what's called a taxonomy system. So if people can think to high school biology, and this is the way I kind of most people can remember that whole animal classification system where you start with really broad terms like vertebrates and invertebrates, and then it breaks it down into more specific animals and classes. And then finally you get to something really specific at the end. Like the only one I can ever think of is Canis lupus for some reason, which is a dog, right? So you narrow it down to that very specific thing. Our system is the same way. You start very, very broad, and then you really work things down into that specific need that you're looking for. So because of that, it doesn't search exactly like a Google. So how to search on 211. As you can tell, I'm from near Red Deer, so I made up this slide, so everything's going to be Red Deer based. First, you choose the town or the community that you're searching in. So wherever you want that resource from. So again, if you're in Fort McMurray and you're looking for a child going to school somewhere else, you would look where that child is going to school, where you're seeking those services. You can also check the distance box there. So you can choose the area you want to search. You can do it very, very slim margins, so 5 kilometers, so very tight, or you can go all the way up to 100 kilometers. If you click the any box, then it'll search the entire province. So I will warn you that if you click any, there could be a lot of different records that come up. But you can search, or you can sort those results as well. So you can sort them by best match, which will give you whatever's closest to the keywords that you're putting in. Proximity would be closest to your location. So that would be the location that you enter into the computer, not your actual physical location. Or you can search alphabetically. So if you have a long list, then alphabetical might be the easiest way to find something. You can also search 2 different ways. So there is a keyword search, or there's a topic search. So the topic search will bring you to a screen somewhat like this. So obviously I couldn't fit the entire screen in there because my little made-up computer on here wasn't quite big enough. But when you get to this, choose a topic. I always use the food bank because everybody knows what a food bank is. So you go to food and basic needs, and you click on the topic that you're looking for, and the next page will bring you to the subtopics. So this is where it starts to get more specific. So then you can go down, and thinking of food banks, I would click on food hampers. So you click the subtopic to get the actual listings. So Janelle, if you want to go to the next one. So this is what the listing page would look like. So as you can see, there's food bank options on here. There's 4 different options. You can click to see it on a map. So if you see the little buttons on the top there, it automatically comes up in the list format, but you click map and it'll show you where all those resources are listed on a map. So you can see what's closest to you, what might be grouped together, things like that. You can also print that off if you want to send it to somebody. We also have a great resource on here called the resource list. So it's kind of like a clipboard feature. You can create a resource list. You can add any of these things to your resource list. You can make multiple resource lists. So if you're giving out referrals for the same thing over and over again, you can actually click things, make your own resource list, and it'll save on here. And every time you need to update that list or things like that, you can go to the link and it'll have all the information that you need. You can print it off on Word. You can print it off in PDF format. You can email it to people. It's a really handy option. Otherwise, if you want to just check out what the information is in the different listings, you can click right on the listing there. So if you look at the big red box, it's pointing to the hamper program for the Red Deer Food Bank Society. So you click on that listing to see all the information. So Janelle, if you want to switch to the next slide here. So this is what that listing will look like. Now it'll give you all the information like the description of the program. At 2-in-1, we really want to make sure that people get the services that they're looking for and that we don't refer people to things that maybe don't fit their needs. So we try to get the best description possible so that you know what you're looking at. There's also an eligibility requirement. So right underneath the description, you can read who's eligible for that program. Because if you're, say, a senior and you're looking for a program and it's a preschool program that shows up, then you know that you're not eligible for that program. So it also gives you all the different contact information, application processes, things like that. If you scroll down, you can get to more information, a lot of different things down there, phone numbers, addresses, emails. Over on the right underneath the map is the hours of operation and the physical address. And if you really want to see what the agency does besides just this program, you can actually click in a couple different places where it says agency, and it'll take you to the agency listing, and it'll list all the different programs that agency offers on top of the one that you selected. So if you're thinking, oh, well, this sounds like a fantastic program, I wonder what else they do, you can click on that and find out what else they might do there. Janelle, if you want to switch to the next one. We also have the live chat option on our webpage. So you can get to it a couple different ways. So as you can see, I've got the big red circles around chat with 2-in-1 on the left-hand side, or down where it says need help, call 2-in-1. There's a little live chat bubbles, I guess you'd call it. And if you want to start the session, you click down there on the very bottom right-hand side. And if you want to switch to the next slide, I'll show you what it looks like. So when the chat message comes up, it'll show up like this. You've reached 211 Alberta, and you just start typing in the box, and someone will respond to you. So again, like Janelle said, it is a real person on the other end. You don't have to try to say, hey, you know what, I want to talk to a real human being. Like when you call the bank or something, and we're always real human beings. Now, that being said, you may have to wait on hold for a little bit if you're calling, or wait for a chat. Unfortunately, we can't determine exactly how long the wait times and what our call volumes are going to be. So you might have to have a little bit of patience before you are connected, but you get to talk to a real human being, which is an added bonus. All right, next one. So 211 isn't just for the people calling in. 211 is for the service providers. These are the agencies, the organizations that have listings on 211. Again, like Janelle said, it's free to list on 211. We want everybody that we can to list on 211. We do focus on not-for-profit organizations, things that are free, sliding scale, because we understand that, if you're looking for a business, you can always find a business. But finding things that people can afford all the time is much more difficult. We want to make sure that we have all the services that we can on here. So 211 can help increase the awareness of services. So like it said in the slide before, we gave out 266,000 plus referrals to different organizations. So chances are that somebody was looking for whatever your type of organization does. Now we're also connected to the Alberta Health website or database. So we all run off of Inform Alberta database, which is the Alberta Health Services database. So when you call HealthLink 811, that's the database they use. So we use the same database, which is great because then we can access health options as well. So if somebody calls in looking for mental health issues, mental health support, things like that, we can go in and find all the different options for mental health support in the system. So that's not even included in the 35,000 records that we maintain. So increase accuracy and appropriateness of referrals. We like I said, we really try to make sure that the referrals are up to date and they're quality referrals, because nobody likes getting a phone call from somebody and trying to tell them that, well, you know what, we can't really help you. You might have to call another location. We want callers, when they get referred, to find the services that they're looking for, and we want your services to be those services. Now, education and training. Janelle and I do a lot of traveling and a lot of education and training. So part of our role is to go out and do presentations like this in the community to agencies, to organizations, telling them all about 211, what there is to offer, talking to their clients or customers, or telling them all about 211 and how to contact 211 as well. So, and then of course we do a lot of collaboration, and that creates stronger networks within our community. So, all the different community groups. We sit on a lot of interagency meetings and all that kind of stuff. So now Janelle talked earlier about calling back. I'm blanking on it, Janelle. What? In that
the warm referrals?
Yeah, right at the very last one. The callbacks.
Oh, okay, right. Yeah, we do follow-ups.
Follow-ups, that's it. Okay, sorry. Brain just turned off. You'd think it was a Monday today. So the follow-up calls. Those follow-up calls are fantastic because they give us all sorts of data. So we maintain all the data that we get from our calls, and we offer it out for free to the different organizations and agencies. And this is just right on our website. You go to the top of the page and you click one of those pull-down menus, and it'll just say 211 data. And it'll bring up 4 different screens full of data for you. So the first page is just overall contacts. So it's got all your demographics, the year, month, location, age, gender, contact method. This is kind of handy just to see who's calling 211 from where. If you hit the next one here, Janelle. The second page gets into more detail here. So The contact method, gender, age, so a little bit more in detailed demographics. The third page here is where it gets more interesting. And the reason I explained that whole taxonomy is you can really see it in this slide. So when you look at these little green bars on here, that's the taxonomy levels that we're talking about. So again, I use Red Deer as our example here. You can choose day, month, quarter, city, so you can break it up into communities. You get results. So in Red Deer in 2024, there was 2,806 needs identified. So you can see that from the little green bar on the left-hand side. The next level 1 needs is all the different levels and all the different classifications, I guess. So basic needs, as you saw earlier, the basic needs is where you would find like food, shelter, clothing, transportation, things like that. So if you follow the little green line up there, there was 661 calls just on basic needs in Red Deer in 2024. So you follow that little green line a little bit further, you get to food. So I, again, used the food bank as an example here. Follow the green line to the next level of needs, you get to emergency food. You can actually click on these and scroll around, so you can drag that whole list over and see level 4, possibly level 5, where it breaks it down even more specifically into the different programs or needs in the community. And you can see exactly how many people are accessing those kind of needs. So as you can see, there's 92 people looking for emergency food. 90 of those were looking for, I'm assuming the top one on the level 4 would be food bank. So you can really break it down. The 4 biggest needs that are identified in almost every community in Alberta are the basic needs, income support, mental health supports, and the 4th one kind of juggles around a little bit, but around here it's criminal justice. Sometimes it goes to other things as well. So organization is a pretty big bar in there as well, but that's kind of a catch-all for all the different little things that don't fit in one of the big things. So that's health needs. If you're looking for childcare, stuff like that, that doesn't fit into a specific one. So this is a great breakdown. And then if you think back to the unmet needs, that's where this one comes in. So page 4 is all the unmet needs. So we take all that feedback from people. We ask, how did that resource work for you? Were you able to access it? If not, why? And this comes in really handy for when people are doing funding reports, funding applications, things like that. You can look at this page and say, well, why weren't people getting the resources that they needed? So again, I went into basic needs. So the blue bars at the top there were unmet needs by type. I clicked on basic needs. So there was 102 by the look of it, unmet needs in basic needs. And then underneath is the reason those needs weren't met. So as you can see, sometimes a caller refused the referral. Sometimes the agency had full, maybe had waiting lists. Maybe you didn't meet the eligibility requirements or things like that. So you can kind of find those reasons, those gaps in service. And if you're trying to do funding reports, funding applications, you can actually use this as hard data in order to say, hey, you know what? This segment of the population is not being served, and here's the reason why. So it comes in super handy. And this is all free. It's all up to date. It's updated constantly, just right there on our website. Now, that being said, you can also get more specific data, and we'll give you the database email at the end. So you can request more specific data either on your organization or your area, things like that. It takes a little bit longer. This is free, easy, and instant. That takes a little bit to get the information. So if you have a funding application due next week, it's probably a little bit late. But if you're working on something for down the road, you can get all sorts of data from 211. All you have to do is ask. What do we have next here, Janelle?
I'm up here next, so
hey,
and I'll
again.
concur. The data is really helpful, especially like Adrian was saying, if you're looking for grant funding or just trying to understand where your organization might be able to fit the needs in your community. It's really cool. It's a cool service in terms of getting like minute by minute data on what's happening in the community and what needs are being called on. So I certainly encourage you to use that. But on that, a lot of our unmet needs that we are seeing, often, and particularly when we're talking about the smaller communities outside of Edmonton and Calgary, are possibly not being met because we don't have the resources or the information into our database. So I'm going to go back to kind of my long spiel earlier on the importance of the resources in our database being current and up to date and accurate. Adrian talked a lot about the information we can pull from our database in terms of hours of operation, eligibility of programs, that type of thing. That's really important to us as 211, that our information that we're giving out to people in those referrals is correct and accurate. Our team every year, we will, as annoying as we might be, we will reach out to every single one of the services and organizations in our database to confirm those details. That is part of our accreditation. That is really important to us, that we are, when we give information to a person, that information is correct, and that they're not going through lots of closed doors because that information might be stale. I know all of us working in the not-for-profit, we know how quickly funding changes, we know how quickly things adapt and move, and so lots can happen in a year. And so our team is committed to staying in touch with our communities. That's why we have our roles in the smaller centers. Our job is to get a really good handle on where those changes might be happening, so that we can keep the information in our 211 database current, and that we're sending people to resources that are in fact there and are available in that way. So that becomes really important. And I think that's a really important segue into this conversation on the importance of having, and I'm going to pick on rural because I think we all care about that today very much, I would hope, that it's incredibly important for us as rural residents that we are getting our information into that database so that if somebody is calling from our communities, they're getting referrals to their community, right? If we don't have information about a particular program in, say, Lethbridge or Medicine Hat, we are not going to be able to refer those people to those programs, even if they exist. And so that becomes a really important gap that we need to address. And all of us in all of our communities have a role to play in terms of making sure that that information is available to our communities. So we are focused really heavily right now on getting agencies on the database. And we do have a lot of excellent kind of reach in that realm. We've got lots of really key players, key organizations on the 211 database across the province. So I do feel strongly that there's really good information there, but I know that there are so many other programs that might not be already listed. So call to action today is if you are aware of services that become very important to your communities, that you might think, hey, I don't think that's on 211. We would really encourage you to get those organizations to reach out to us or to let us know, and we'll reach out to them just to make sure that that information is in fact current in our database and that we're able to get people connected to the right resources. So that is really key today. That is our major kind of priority and commitment at the moment. It is a really easy process to get on 211 Alberta. As long as your organization's services are free or low cost, but more likely free, we will prioritize those listings. The only big hurdle for us is that the organization needs to have been in service for at least a year. Again, we just want to make sure that those organizations that we're referring to are sustainable, and that we're sending people to a person that is in fact going to answer that call and be able to support. But otherwise, really easy process to go through. It's a form that we've got online. We'll go through. Our database team will connect and confirm all of these details. We want to make sure we're getting the right operation hours, or hours of operation rather. We want to make sure that we have the right eligibility and criteria. If there's any particular audio priority target audiences that you're focused on, we gather as much information as we can so that we can make really good referrals to those services that are out there. I'll give you a quick example for the database. Lethbridge in particular, if anyone's from my neck of the woods, we've got great services coming out of Lethbridge Food Bank. But of course, we know that there are many programs being offered through that organization. And I know all of us working in this industry, we know lots of those services, but we also know that lots of them change or move, or there's other things that we might not be aware of that is available. So it's really important to have all of this data in our space that we can access as a collaborative community to be up to date on what's available out there. So Lethbridge Food Bank, just two resources that are available here that I'm going to pick on, but we know that there's lots more in that organization. But for the food hampers, that becomes a really great resource and certainly one that people call about in terms of getting access to food. We will go into as much detail as knowing when the pickup times are, what days they're available, so that we're giving people that good information in terms of when would be best for them to actually reach out or to stop by that organization to get those things. So we'll have that detail in here for all of our food banks across the province in terms of when those pickup times are, where those locations are actually available across the cities. Other programs are going to look different, so we will have it specific to the Mindful Munchies program, which is our school lunch programs. We have information on how to get on or get into that list, where kiddos can access food, what schools are opting into that program, all of that kind of information that someone might need info on that is very specific to the services. So again, our team goes into an incredible amount of detail on how and when and where those programs are offered and how people can get access to them for two reasons. One, to make the caller's life easier so that they have all the information they need. If we are referring somebody to an organization and we know that they're going to need a financial statement or an ID or any of those things, we want to make sure that they're aware of that before they go take an afternoon off or have to venture across town to this organization. We want to give them as much information as possible to make that easy for them so that we're removing any kind of barriers or obstacles. And then the other side is making not-for-profit lives easier, that information is getting sent to individuals that is correct and accurate so that when they show up at your doorstep, they're ready to go and you don't have to kind of navigate that process. So again, we will do the annual update. We promise you won't hear from us more than once a year, most likely, unless there's other fun things happening. But you will certainly hear from us at least once a year because we will be confirming all of those details. So we typically will do, once you're on the 211 database system and you've been approved as a service that is listed in our organization, we will then get you on an email request once a year for updates. If you don't answer the email, we'll just start calling you and bug you and you'll hear from us. But we'll certainly get in touch and make sure that we can get the information that's correct and just if there's any required changes. Often not a lot changes for agencies, so it can be just a really quick, hey, everything looks great and we're good. So then that's perfect. We're good for the year. If you've got other programs that have come up that you wanted to include, if there are hours, eligibility, whatever those changes might look like, we will go through that process with you once a year just to make sure that it's complete. With the clause that, of course, if anything's happening in the year that you want to reach out to us before you might get that annual update, you are always welcome to get in touch with us and let us know if there's changes or new programs. Maybe you got a grant approval and you know that there's a really awesome program coming through the doors quickly and you want to let us know. We would be delighted to hear from you and get that information on our website as soon as possible. But like I said, you'll hear from us once a year, or you can certainly reach out and let us know if there's updates as they roll out. If you are interested in becoming a 211 database service, if you have not been on 211 yet and you think that you might want to be, I would actually recommend probably best step is just to email Adrian or I, but you can also go to a suggest the update online at our website and pop in your information there, and then one of us will get in touch with you to get your organization set up. Like I said, it's a really quick form and process to get you in. But certainly you've got two options. You can either go straight to the website or you can email one of us and we'll go through that process with you. Adrian, do you have something to add?
Yeah, actually that suggest update button is also fantastic because I don't know if anybody here ever gets funding once a year. All the funding, sometimes it comes in, in 1 month, sometimes some funding comes in another month. And so updates don't just happen once a year. If you have an update that you'd like to get on there immediately, then you can hit the suggest update button any day of the year and update your information right then and there. And within a day or two, it'll be live and on our database. So it's super fast and easy and it doesn't have to be once a year. So, sorry.
Thanks.
I just saw that
Awesome.
and love that little feature. So, um, so as Janelle was saying earlier, 211 is across Canada. So we keep talking about our phone, chat, text, online option, but there's actually a mobile option as well, and it is 211 Canada. So if you're searching on your iPhone or Android phone, anything like that, there is an app on there. So you search 211 Canada, or you can just scan this little QR code. This will give you a link to our 211 website, so ab.211.ca. It'll also give you a link to the Apple App Store if you want to download that 211 app on your iPhone, or the Android store to put it on your Android, Samsung, whichever other phone you have, I guess. So we'll leave this here for a second in case anybody's scrambling to find their phone and get the camera open, because I know that's my thing, is all of a sudden you need the camera and you can't figure out where the buttons are. We'll maybe come back to this one later if anybody needs it, if you want to hit the next slide, Janelle. This last slide, and we'll probably come back and just leave this on here for a little bit once we get to the questions, just so people can find it. So this is our contact information. So we are on Facebook. We're on, well, it says Twitter on here, but it's now X. We're also on LinkedIn as well. So you can do a few things on there. General inquiries. So if you're just looking for information, say you want that listing policy that you kind of saw earlier, are you actually able to, do you qualify to list on 211? We can send that out. The general inquiries can answer any of the questions that we can as well. The database team. So if you're looking for some of that data and you want to request a data request forms for specific data, or maybe you have a question about how things are phrased on the database, you looked up your record, your listing, and you're like, wow, why is this in this format? Or you can always get a hold of the database team. And I'm kind of cheating here because my name is on the bottom of this. But Janelle's is on, I do believe, the next slide as well. So if you want, and our phone numbers. Alberta apparently has a new area code. It is 368. So we aren't phoning from some weird place in some random country. We do have a new area code in Alberta. And fortunately enough, Janelle and I both ended up with phone numbers with the same crazy area code. So you're not phoning some weird country. We're right here. Our phones are right in our laps. So you can get a hold of us anytime. We might not answer anytime, but you can touch base anytime. So we're to that point of the presentation where is there any questions? So I saw some in the chat bar. I was trying to answer some as Janelle was going on there and talking about all the different ways to update. So I guess now we'll open it up, and Janelle's email is on here as well. So if you want to snap a picture or anything like that, a screenshot, if you need to get a hold of either of us, email is right there.
I can jump into just to help facilitate a little bit if that helps. I appreciate you both, or we appreciate you both for taking the time to present to us today. Lots of really good information on 211. I didn't know that we had another area code. So not to say that that's the only thing I took away from your presentation today, but I did not know that. No, we really appreciate you showing up today and sharing this information. Adrian, you're totally right. And I see that you're answering it. So one of those questions was about the Northern reps, and you already put Kelsey and Mel's information in there. So that was perfect. Regarding those resources being updated, it sounds like that's really dependent on the agencies. So what I took away today was that that's the big push, right? Is that you are depending on those agencies. So when people ask about timelines on those agencies or on the resources, you aren't going out and updating those resources yourselves. Is that what I understand, that you really rely on the agencies to update that themselves?
I would say about 95% of the time we rely on the agencies to update themselves. Sometimes, like anytime I go into a community, I'll kind of look up which agencies are there and see what kind of listings they have. And we attend a lot of different interagency meetings and community meetings in all the different areas that we're in. And while we're there, we love to just touch base with people and see if, is your listing the best it can be? A lot of times the call centers really, really rely on that description, the eligibility criteria, in order to make those positive referrals. So if there's a place out there that maybe they could update their information a bit better so that they get better referrals, then we'll touch base with them person to person as well. So it's a combination of both, but unfortunately we can't be everywhere all the time. So we do rely on a lot of those folks to update themselves.
Part of our accreditation program as well, though, is that our database team will actually, like, they are required to go through each and every one of our listings to touch base once a year, right? So every one of our services has been connected on an annual basis. It's just that those rolling updates that are occurring, we would not know that your organization might have changes. So if you know that information, and think that that's important information to pass on to both the database and to have for the community access, that is certainly something we would love to get from you prior to that yearly update.
You bet. And unfortunately, over COVID, a lot of contact information changed. So with the with all the admin positions and things like that that were vacated over COVID, we did lose contact with a few different places. So unfortunately, some places aren't as up to date as they could be, and we're really trying to get out there and update that. So again, that's where having that self update comes in handy.
Yeah, no, definitely. So just another question that we got in the chat was if there was a way to search for newly added services within a community. So they're a service provider, or if they're a community member who may want to see what the new options are, is there a way to see what those are in case they're referring themselves?
Yeah, I actually would recommend, just given the circumstances of this group, and we're all rural people, I think your best bet is actually to stay in contact with whoever your representative is for 211 in your rural area. So whether it's myself, Adrian, Kelsey, or Mel, we will often kind of share that information in terms of the new updates that have come in through our region. So if you're saying, hey, I'd like to know if there's stuff happening in Medicine Hat, we actually have that data as it's rolling. We have a pretty good finger on the pulse in terms of what's being input into 211 Alberta. So I would actually say get on board there. Maybe we need to start a newsletter or a quick email list to the to the groups that we're kind of supporting in our regions, to give you a quick synopsis of what has come in the last month, which is always an exciting thing. We celebrate that internally on our team, so it's certainly something that would be easy to pass on if that's something you're interested in. But for searching, that would just be based on, we don't have the timestamps on what goes into 211. If you pull a resource list out of your community specifically, and you'll be able to quickly scan and see what's new or what's not, or what you've already seen in there before. But of course, it'll hopefully be an extensive list. If it's not, that's our goal. So best bet is if you want newly updated listings, to contact one of your rural reps.
Okay. No, that's awesome. And you're getting thank yous from the chat. We only have about 4 minutes left, and I wanted to end on just maybe a feel-good story about maybe a successful partnership or outcome that made a meaningful difference in a rural community by using 211. Just if you've got one, maybe.
Yeah.
If not, that's okay.
Do you want to take this?
Oh,
we have lots of them.
Yeah,
It's a matter of
where do we
figuring out
start?
who wants to do the talking. So in my area, I sit on a couple different committees and collaborations, I guess. So part of my area is Innisfail, Alberta. So I've been sitting on the Community Partners and Action Committee. So it's kind of a community led initiative on aging well. So there's lots of different initiatives going on. There's social prescribing, and it's a great opportunity to not only share 211's resources, but to help out the community and make sure that the community and the collaboration that we're having there is running most effectively as it can be. I don't know, Janelle, do you have a quick? That was a super quick synopsis of what I was doing there, but
Yeah, I remember my very first day with 211 Alberta. Well, not first day, but the first weeks of 211 Alberta, and getting into the training with the call center. And so we were able to sit on some of the calls that came in, and it was always special to me because the very first call that I got to sit in on came from Medicine Hat, and that is my region, and those are my people. And so it was really neat to have a caller call in. It was someone who was both a senior and also did not speak English as a first language. And so I got to see that whole process. They were having big challenges trying to get forms filled out for the government and needed some support. We were able to connect them with and immediately with an interpreter. got them connected to the right people in the community to actually sit down and help them with those forms. It was one of what we would say is probably one of the easier issues to deal with, but it was a big deal for this person, and it was really cool to see it in my community and be able to witness that through the interpreter line too, because I think that's just such a cool resource, and one that I know all of us, when we work in rural communities and we're supporting, particularly with the new immigrant populations, that can become a huge barrier and huge challenge. And so it was really nice to just see something so tangible and so quick and effective. And I was just blown away by how well oiled that machine is and how well it worked and supported. And I will always remember that call because it was just really nice. Seeing that process of kind of calling in, feeling really stressed, and then all of a sudden realizing, oh, I can get this service in my language, and it was just like immediately that stress level went down, and they were able to get their needs met. So, and of course, that's a very small little one, but that one's always just something that always touches me, or I remember that person well, just going through that process. But there's certainly so many, lots of the calls can be really challenging, and the fact that, there's a lot happening. We've seen lots of things around when we talk about legalities, a lot of it happens to be housing concerns or landlord to tenant issues that come up, or just people in really tough places, right? So there's so many times where I think just knowing that there's a resource there to lean on, that, lots of us we don't go through a lot of the situations that come up in life all the time. And so it's really hard to know where to turn or who to talk to. So just knowing it's there is really important. And I think that's always been kind of what I think is the most valuable thing about 2-in-1 Alberta.
Well, thank you, Janelle, and thank you, Adrian. It was very insightful today.